It is not unusual when a woman hears that she has fibroid tumors that her first reaction is, I don't want to have surgery. And oftentimes, what she is expressing is fear, concern, and not having enough information, and being concerned that she may cause damage or that it may interfere with her ability to get pregnant, and just not knowing what's possible. So I'd like to take a few minutes to say, yes, there are non-surgical options, but you have to be able to address 4 specifics. First being, what is your overall health? Do you have a medical condition that would preclude you from taking certain medications? Also need to know, well, what is the precipitating symptom that's making surgery even a consideration? Is it bleeding, pain? Is it fertility issues? Is it just that the fibroids are too large? And what is your age? Are you premenopausal, perimenopausal, postmenopausal? What are your thoughts about children? Do you want to become pregnant? All of these are important considerations, and they either and they can eliminate some possibilities. And then we have to consider the fibroids themselves. Are we talking about one fibroid, multiple fibroids? So we need the number, we need the location. Are they pushing into the cavity? Are they on the outside? And we need to know the size. So we have to factor all of those things into this equation when we are trying to come up with non-surgical options. Basically, though, non-surgical options are either medications or procedures. When I say medications, there's a group of medications which alter your hormones, which are used primarily to control bleeding. And you're familiar with these. These are birth control pills, progesterone releasing IUD, GnRH agonists and antagonists such as Myfembree, which alter the hormones which help to decrease bleeding. And then there's a medication specifically to stop heavy bleeding, and that's tranexamic acid. Generic name, brand name is Listida, and that's for slowing down bleeding. For other issues such as too large, you may want to either destroy the fibroid itself or remove the fibroid somehow. And often we're talking about procedures such as uterine fibroid embolization, where you basically stop the blood flow to the fibroid so that you essentially starve the fibroid and it starts to shrink. Or a newer procedure, which is ultrasound guided ablation of the fibroids. You actually destroy the fibroids using ultrasound. This is a newer procedure and not available to everyone everywhere, which brings us to a third consideration, and that will be your provider, your physician. Is he or she able to offer these multiple options to you? Does your hospital affiliation provide these type of procedures to you? And then does your insurance cover specific medications or specific procedures? So there is a lot to consider. The good news is that the research and our understanding of fibroid tumors is constantly evolving, and we are starting to move from waiting until she becomes symptomatic to maybe we can start to address the issue when it first develops, when things are still small and more manageable, to give us more options. And so it's an exciting time for this research. Stay tuned. But the bottom line for you today is ask questions. Ask what are your options. Find out. Until the next time, this is Dr. Rahman saying, take care.